Hello everyone, my name is Christy Sutton and I will be presenting case study 2 for Ball State University SPCE class 638. Client description. My client's gender is female, age 8 years old, diagnosis autism spectrum disorder, communication nonverbal. She utilizes a picture exchange system known as PECS for communication. Therapies, she attends speech therapy 2 times a week for 1 hour and ABA one-on-one 3 times a week for 4 hours. She also attends special education classes in a public school setting but does not have one-on-one staffing at school. She does not go to school full-time. She goes to school part-time, and this is because the necessary breaks such as recess and PE and everything else and enrichment she does not have to have. In her classroom, there are a total of 10 students and 3 teachers, one being a certified teacher and the other 2 being paraprofessionals. My client's problem behavior is tantrums when she does not have access to her preferred tangible. Operational definition: screaming and or crying with vocalizations above normal conversation volume accompanied by facial expressions for a period of time with tears and refusing to stand up and flopping to the ground repeatedly when tantrums are occurring. Operant extension is withholding all reinforcement from a previously reinforced behavior maintained by its consequence. So for my client, previously behavior therapist would physically prompt the client to utilize her picture exchange system for what she wants, which were her preferred tangibles. Currently, behavior therapists ignore her behavior and remove her preferred tangible from within her view and use a stopwatch to record the duration of her tantrum behavior before she stops her tantrum behavior and moves on to a non-preferred tangible or non-preferred task. It's important to note that the safety of our client, or my client, was the top priority when behaviors were ignored. Assessment/socially meditated that were utilized was ABC data, direct observation, and duration of client's tantrum behavior. Client's problem behavior of tantrums was not socially meditated. My client did not engage in tantrum behavior for attention, but engaged in tantrum behavior to receive preferred tangible item back when unavailable to client. Usually my client did not have access to the preferred tangible item due to a man being placed on my client to complete a task or to complete a non-preferred task, which basically the same thing. DRA procedure that was used for my client was if she is able to follow one-step instructions that does not include engaging in the tantrum behavior, she will receive access to her preferred tangible. If it is an electronic tangible, she will have access to it for approximately 3 minutes. If it is a preferred tangible food item and or toy, she will have access to it. She will receive that preferred tangible. Upon completion of her non-preferred task without tantrum behaviors, she is provided verbal praise, good job, yay, and she loves high fives, so I provided her with physical high fives. She is also awarded 5 to 6 minutes duration of a preferred electronic tangible or what the client may score successfully. The DRA procedure for her is unconditioned reinforcer. Unconditioned reinforcer, defined by the Cooper Book 2020, is a stimulus change that functions as a reinforcer, although the learner has had no particular learning history with it. Stimulus control. Stimulus control, defined by Cooper Book 2020. Stimulus control occurs when the rate, latency, duration, or magnitude of a response is altered in the presence of an antecedent stimulus. My client engages in her tantrum behaviors when she does not have access to her preferred tangibles and has demands placed on her by her behavior therapist to complete non-preferred tasks. When my client's behavior is ignored by a therapist and the preferred tangible is not within view for my client, her tantrum behavior does decrease. And she does move on to the non-preferred task that was placed, such as the man placed on her. And on this slide is my reference from the Cooper book. Thank you.